today. It's just called Wednesday. Every day is Wednesday.
Okay, good morning. It's April 10th. Welcome to the Mayor's Health Roundtable. We'll start off with Mayor Perry with some opening remarks.
Once again, thanks very much, everybody, for taking part in this call today. The theme this week, of course, is that this is a very, very important weekend. Every message you will receive on any media is underscoring the fact that this is an incredibly important week as this COVID-19 crisis unfolds. We have Dr. Cannon with us here this morning. As you can imagine, she's very, very busy. She only has time for a couple of questions after, but I'll put her on right now. Thank you very much.
Thank you, Mayor Perry, and good morning, everyone. And for those who are celebrating Easter and other events this weekend, I wish you all the best, and I wish you all the best with your immediate family, who are the only ones that we want you to be visiting with. So today, the Porcupine Health Unit is unfortunately reporting 3 new COVID-19 cases in residents across the area. The first is a female in her 30s who was confirmed as a close contact of another case, is currently home in self-isolation, was tested on April the 4th, and it's in the area of Matheson, Iroquois Falls, Smooth Rock Falls, and Cochrane. The 36th case is a female in her 60s, again a contact of a confirmed case, currently admitted to hospital in Timmins and was tested on April the 4th. And the last one is a male in his 60s who is a contact of a confirmed case, was tested on the 4th as well and currently in self-isolation in Timmins. Again, I cannot emphasize enough the respect for privacy and confidentiality of all of our cases, and our ultimate gratitude and thanks to the cases, all of the contacts that we are in touch with on a very regular basis, as well as the PHU team who's working diligently to make sure that we are connecting with all potential contacts and providing the appropriate guidance and follow-up as necessary. We continue to wish all the cases and all of their family members well. Thank you. At this point in time, or at the end of last night, as our usual reporting schedule, there's been 595 tests done across the PHU with 37 positive, 457 negative tests, 101 currently pending, 11 positive cases are now resolved, and 2 unfortunately deceased. Today and for the rest of the long weekend, through including Monday, the Porcupine Health Unit COVID information line is open from 11 a.m. to 3 p.m. So we're following our weekend hours over the long weekend. Call 705-267-1181 or the toll-free number 1-800-461-1818 for any questions or concerns or continued assessment of any potential symptoms and next steps. The Timmins Assessment Center is also open for the next 4 days, 11 to 3, and we continue to work closely with them to support any assessment and potential testing as determined by the clinicians at the assessment centers for individuals. Community transmission of COVID-19 is occurring in our area. Everyone but essential workers needs to stay home. Only go out if absolutely necessary to pick up groceries, prescriptions, or to a medical appointment. If you are going to a medical appointment and you may have symptoms suggestive of COVID-19, please call ahead or inform any care providers immediately upon your arrival that this may be the case. Stay home if you are not feeling well and contact the Porcupine Health Unit or your primary care provider for next steps. But do not go out and do not potentially spread any illness with anyone at this point in time. You may enjoy the outdoors this Easter weekend. However, we absolutely urge you to only stay with your immediate family members. Enjoying the outdoors is not a license for social gatherings or visiting with others, and this is critical. The next part is you can only go outdoors if you have not been diagnosed with COVID-19 or do not have symptoms of COVID-19 or have not traveled outside of Canada in the past 14 days. If any of these are the case, then follow the public health guidance that you've been provided, which often dictates that you may be able to just be outside in your immediate yard if you're simply in isolation and monitoring, but please follow the appropriate public health guidance and do not visit with anyone else or go to any public settings whatsoever. If you do go out for a walk, please do not go out and walk or run or, well, probably not bike today, but maybe when we get nice weather again, with people that you do not live with in your immediate household. Maintain physical distancing by keeping 2 meters from others at all times. This holiday weekend, we all have to work together to really reduce the spread of COVID-19. Celebrate any religious, spiritual, family holidays with your immediately household only, and stay home. Avoid non-essential trips out, and especially non-essential trips between communities. No gatherings with others, even outside, even if you're 2 meters apart, even if you have a mask on. Please don't. Find other ways to connect. Do not take a holiday from stopping the spread. If you are unwell in any way, stay home. Whether someone has symptoms or a positive test result, the most important message and the most important step for us all is to stay home and not expose others. Keep physically distant but socially close. Stay home if you're feeling ill and call for support. Wash your hands often, wash your hands well. Don't touch your face. Clean commonly touched surfaces within your home, even if you're going out minimally, it's still important, and help us stop the spread. Thank you again to all community members across the PHU for your help in protecting your loved ones, yourself, our healthcare providers, our workers that are still working in essential service areas, and all other community members. The actions of each and every one of us can have a tremendous impact in flattening the curve. Staying home will save lives. We are all essential workers in reducing the spread and the impact of COVID-19 within our own community. Stay home, stay well. We're all in this together. Wishing you a healthy weekend with the loved ones within your home. Merci, miigwech, thank you.
All right, thank you, Dr. Catton. As stated earlier, the doctor has time for about 1 or 2 questions from the media if there are any. So I'll ask right now, is there any questions for Dr. Catton?
Morning, David. It's Bob McIntyre at Moose FM. Doctor, can you explain the difference between close contact and community transmission, please?
So close contact means that it's an individual that through the public health investigation process, we have identified as being in close contact with the case. This is often somebody who's within the household, who has worked with them very closely, who has spent a certain amount of time within a certain amount of distance that ends up being designated as a close contact. So when we say close contact, I'll be honest, it means the public health, we've done a really great job, because the majority of the close, I think all probably, of the close contacts that we've identified, that we've announced as close contacts, are individuals that we already identified in our investigation process of the initial index case. And so they were already individuals that we were in touch with on a daily basis, that were already following all the public health guidance, and we were already talking to many of them on a daily basis. And so that's the designation of a close contact. So it's a very, it's a lengthy process to go through. And so when we talk about community spread, it means that we don't have a connection to a close contact, nor is there a connection to international travel. And so that means that it is circulating in the community and that somebody has picked it up from an exposure elsewhere. And so that's why the most important points of staying home as much as possible, washing your hands, not touching your face, cleaning commonly touched surfaces, and really, really working to maintain that 2-meter distancing is so critical. Because in the end, those types of exposures are what can lead to more cases. And so those are the steps that we need absolutely everybody to follow. And the more that we follow those steps and reinforce those amongst our families, wherever we're out in public, the greater chance we have of reducing the spread. So that's the difference. Thanks, Bob.
Thank you.
Hi, this is Jean-Loup from Radio Canada. I just had a question regarding Extendicare. Extendicare Timmins mentioned on their Facebook that no residents have contracted the virus. Can you say whether or not the residents have all the residents have undergone their a test or are going to get a COVID test?
Hi. So at this point in time, we are continuing the investigation and follow-up with Extendicare. We're following all the public health guidance with respect to the steps that need to be followed, the steps that have already been taken by Extendicare in protecting all of their residents and their staff, which I can tell you are extensive. And again, I just need to re-emphasize that the potential exposure in this case was extremely, extremely low, extremely low. And we're already close to the end of this possible outbreak and at the end of the point of monitoring. But so far, any tests that have been done are negative. Thank you.
Okay, thank you.
All right. Thank you, Doctor. That's all we have from the doctor today as she rushes from one emergency meeting to another. So we appreciate that, and we appreciate her attendance on Good Friday with everything else that she's got in front of her. Next up would be the Timmins District Hospital, who is not going to be on the line this morning, but did leave a message for us, stating that the Timmins District Hospital would like to wish all frontline and essential workers, their families, and the community a safe Easter weekend. While we should all be physically distancing to stop the spread of COVID-19 in our community, we should not be socially distancing ourselves from family and friends throughout the holidays. We encourage people to safely connect with family by phone, over Skype, FaceTime, or other online platforms. As a reminder, free phone and TV service are available in all our patient rooms. Please contact the general information line at 705-267-2131 for more information. And as well, a reminder that you don't invite COVID-19 to your dinner table this Easter. Stay safe, stay home with immediate family members only, and please wash your hands often. If there's any further questions for the Timmins District Hospital, you can email Kaylee Russell, and we'll look to get a response from them. Going from there, our next update would be the Cochrane DSAB, if there is one today. Brian Marks?
Yeah, good afternoon. For our emergency medical services, we responded to 24 calls yesterday, 10 of which were in Timmins. 7 of those 10 failed the screening protocol. Food security programs, volunteer coverage is in place for the weekend schedule. And remember, if you need to access the food security services, just go to the DSAB website, www.tdssab.on.ca. We also have arrangements in place for food deliveries to those who are unable to make the food security programs. For the homeless population, we've got 30 patrons at Northern College. We've got 10 patrons at the McIntyre location, and a small number remain at the Cedar Street location. The living space personnel are on site at all 3 locations to ensure everybody observes social distancing. Thank you very much, and on behalf of the Cochrane DSAB, wish everybody a safe and healthy Easter weekend. Thank you.
All right, thank you, Brian. Next, we'll have Chief Lochran offer a few comments.
Good morning, everybody. Again, happy Easter, and again, a shout out to all the first responders who continue to amaze us day in and day out as we go through this crisis. I just want to talk today about a couple of things. One is timeline. So a week ago today, we declared a state of emergency for all the good reasons that we did. Our municipal emergency control group has now been meeting for well over a month. And really the whole idea for us is that we're responsible for supporting the actions of all agencies, and many of them you hear here on a daily basis, responding to an emergency, defining overall strategy, and planning for secondary effects of any emergency or disaster. I think when you think of that, the City of Timmins and the partners have done a great job. But we have a couple of challenges. And the 2 challenges are, 1, PPE. Again, PPE as we go forward is becoming a bigger and bigger challenge, not only in Timmins, but elsewhere in Ontario, Canada, and the world. So that on a daily basis is where I spend a lot of my time trying to source that. And the second one is people not taking this seriously. I think if you were to look at the graph of Timmins over the past month and see where it's grown, it's going straight up. So obviously we have a lot of people who are taking this seriously, and then we have those who figure this will never touch them. So again, I urge people over the Easter weekend to enjoy what we have at home, to share that with the people that we have with us in our home. But at the end of the day, we have to, if we're going to beat this, We have to listen to what health units and others are telling us. So again, I wish everybody a happy Easter, and hopefully you will take some of what I said seriously. Thanks very much.
Thank you, Chief Loughran. Right now, we'll go to the media if there are any questions from the presentations this morning.
It's Bob at Moose again. I have a couple quick ones. Brian Marks, this is the first time I've heard it, maybe I've missed it before, but that you have a McIntyre site for homeless. What can you tell me about that?
Yeah, so I mentioned it yesterday that there would be a third location. As it stands, we have 30 at Northern College, and we required another additional site, just given the patrons that were unable to be housed at Northern College. So, in conversations with city officials, we were able to access the McIntyre curling rink for that third location. Okay, thank you. One more thing for you, Brian, before you go. You mentioned every day that a certain number of EMS patients fail the screening protocol. I'm not sure what you mean by that. Well, for every call that paramedics respond to, the people who are making the call are screened actually 3 times. Once they're screened by the 911 service, then they're also screened by the medics when they arrive on site, and then they're screened again by Simmons District Hospital on drop-off. So at any one of those 3 points, they can fail screening. For our purposes in emergency medical services, when they fail the screening either by 911 or when we show up at the door, that just requires the paramedics to don all appropriate personal protective equipment. Okay, thank you. I appreciate that. Dave, I've got one more question. I don't know if it's for you or the mayor or Chief Loughran. I just noticed coming in here this morning that there's one of those big signs in the parking lot at Singer and Algonquin giving information on who to contact for information about COVID-19. Who put that there?
Those signs that have been moved into place are the Public Works road signs. So our Public Works crews move those into place so that we can, continue to reinforce the public health messaging of where you can get good information, that you should stay home, that you should wash your hands, and so we've got the large billboard across the river. We've got a construction billboard, right in downtown, as you mentioned, and then there's also one out at the Whitney Arena, so that people traveling through the community at different points will continue to see reinforced messaging of what we all need to know.
Not that they should be traveling through the community, though, right?
Well, yeah. I mean, people, on their way home from the grocery store, perhaps for their essential needs, or as essential workers return home. Ideally, you're right, Bob. Everybody is staying home, staying safe, and staying put.
Okay, thanks for that, Dave. That's all I had. Thank you.
All right, thanks for those questions. Any other questions from media on the line? Okay, with that, then we'll ask Mayor Peary to offer closing remarks today.
Once again, extend my thanks to everybody that's out there in the community dealing with this on a daily basis. What we're trying to do. The numbers that we're reporting today reflect essentially what the status was in the community a week ago. When we talk about this being a very important weekend, obviously by this time next week we'll be reporting the results of how successful we were this weekend in following that basic message of staying 6 feet apart, having your Easter with your own immediate family, and taking all the necessary precautions. This is a very important day. It's obviously Good Friday, Passover, and we've got to remember all those that are out there. We think of the first responders, but last night I stopped at the Shoppers Drug Mart, and I just stopped to pick up some vitamins, check things out, and I will comment that I thought our first week with the vital officers in the community was incredibly successful. Great improvement at the Walmarts of the world and other stores that are out there that we're receiving some complaints about. Very, very, very good. So very successful interaction by our vital officers. So reasonably happy looking around the community last night, stopped in at the Shoppers Drug Mart, and very simple question, how's your day? Cashier's working in an essential service drugstore. She said, absolutely terrible. I had to wait, my shift's over in 2 minutes. Basic reason was there's a lot of frustration out there. Don't take it out on the people that are working. Remember what this weekend is. Remember the basic teachings of kindness and compassion. You may be frustrated. You may be angry. Perhaps you think you have all the reasons in the world to be that way. Remember, try walking a mile in somebody else's shoes that's out there. Be kind, be compassionate. This is something we're all in this together on. Remember those teachings. We'll be here tomorrow. We'll be here Easter Sunday. We'll be here Easter Monday. Thank you very much.